My name is Michael Marchone, and I'm a nurse practitioner at Frederick Health Hospital. I'm here to talk about some tips to keep your heart healthy. Signs and symptoms of a heart attack can be very difficult to recognize sometimes. So here's some of the ones that you should look out for. The obvious one is chest pain. That can be sometimes felt as epigastric pain or pain that feels like reflux, pain that goes to your jaw or your neck. Sometimes this pain can go down your shoulder to your arm. Also, sometimes patients have shortness of breath or pain in their back. So it can be really difficult to distinguish between what is normal and what can actually be a sign of a heart attack. So if you're experiencing these symptoms after you've walked up a flight of stairs, that is concerning. If you're having pain that lasts for a few seconds and goes away, that's usually not anything to be too concerned about. But if you're having pain that's lasting for more than 5 minutes, that is usually a time that you should start to consider that this is something that's not normal for you, and maybe you should reach out to your healthcare professional to let them know about your symptoms. Or if you're having symptoms that are really concerning and intense, then I recommend that you call 911 so you can be evaluated right away. Having a heart-healthy diet can be a challenge for some of us, especially in our busy lives. So eating a balanced diet that is something along the lines of a Mediterranean diet is one of my favorite things to recommend to patients. So eating chicken, fish, baked, broiled, and grilled, and trying to reduce the amount of fried, greasy things that we eat is the most heart-healthy option. Some patients even go as far as to have a plant-based diet, because a lot of the studies these days continue to show that a plant-based diet is the most heart-healthy diet on the market at this point. Tobacco use and vaping can have negative effects on our heart, and you may not feel them now, but they, over time, these will have a permanent effect on our heart and lungs. So I recommend that if you smoke, chew, or vape, that you should seriously consider finding a method that works for you so that you can quit. There's many methods out there on the market that work, and each individual has to find one that works best for them. There are medicines, chewing gum, patches. So if you have finally gotten to the point where you're ready to quit, I recommend that you reach out to your healthcare provider and see about the different options that might work for you. It's also important that we follow up with our healthcare providers about monitoring our blood pressure, the management of our cholesterol and blood sugar. These are all things that we often don't feel. We don't feel when our blood pressure is high, we don't feel when our blood sugar is high, or if our cholesterol is not well managed. But these are things that can have a long-term lasting impact on our heart if we don't keep them monitored. So it's important that you follow up with your healthcare provider regularly so that they can run tests and monitor your blood pressure and make recommendations and possibly even start you on medications if these things can't be managed without medication. These are stressful times for all of us, so it's important that we find healthy ways to manage our stress. This is different for each one of us. We have to find a stress management routine that works well for each of us individually. So if you like to go for a walk, exercise, talk to friends, hang out with your pet, you have to find a way that's gonna help you manage your stress best. So find that thing that you enjoy doing, and that is how you're gonna manage your stress best. The most important commodity in life is time. We don't have enough of it. So I recommend that you take care of yourself now so that you can have the longest life possible to spend with your loved ones.